Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk to you this afternoon about rotation of teeth. This is a big part of orthodontics where so many teeth are rotated in the wrong way, and you can have the tooth rotated by just looking down on the tooth from the very top of it, or you can come in. Let me get this little deal going here. You can just come right on the top of the tooth and you can turn it in that way, or you can have the tooth laying down out like this, and maybe the roots coming in here, and you can set this tooth up and put it beside another tooth in this area. And you can do this on the tooth at any age and almost any body. They just have to have some halfway decent bone structure there. And you can set this tooth up and have it set right in here. As you go up with it, it's going to move back, and then you hold the force on it and pull it forward and close up the space over there. So let's get into the actual rotation. I'm going to show a fine lady we had, and she had rotated a tooth. She's got several things wrong with the teeth. She's got a deep bite, and she has a class 2 malocclusion, and there's some crowding, but not an excessive amount of crowding. When you've got a class 2, normally your lower anterior can be fairly straight. And back in here, this is kind of a class 2 division 2, like the upper centrals are leaning back a little bit, so we got another deal. And the lower anteriors are way up here almost on the gum tissue in there, so we're going to have to open the bite, so we're going to raise these and lower these and get everything leveled out on the sides. Now, looking at it from this side, this is almost a perfect class 2 problem. You've got this molar right here. It's the first molar up above is contacting the bicuspid. Actually, it's supposed to be opposite of that. This tooth should be back here somewhere, and your bicuspid would come in between here. So this is almost a perfect class 2 with it back in the back like this. Where you have room for your lower anteriors when you have a class 2 malocclusion. So these teeth are not really crowded, they just have over-erupted. Now these are kind of tilted back, you can see, not severely, but that is bad enough to call it a class 2 division 2 type. And when we look at the other side, it's just as bad, but there's a tooth here that's almost 90 degrees rotated. See, it comes on out here. This tooth really needs to be turned around in this direction. You can see it more when you look down on the tooth from the top. Now this is the upper teeth, just looking at it when we started it in 7 of 83. And this is this tooth this bicuspid, you see, is sitting right in this area. And it needs to be turned in this direction. This is the buccal surface. So I think we put the bracket over here and put it around. So let me get on with this, because it's going to take a little while to do this. Now here the tooth is, and the very best way to rotate something when it's nearly, 30, 40, 90 degrees or 180 degrees. You can turn the blooming tooth all the way around if you want to. Now you attach an elastic chain to the arch wire on the rotated side, you see. And now this elastic chain goes all the way around, but it's under the gum, and you come out over here, you've got some dental floss on it, and you take that and pull it over the bracket, but you don't put it on the arch wire. And this is pulled real tight, and this tightness of this keeps the arch wire right up against this tooth. Now it will actually spin this tooth. You can turn it 360 degrees if you wanted to. And you can actually get patients that can learn how to put this on. If it's somebody, like a friend of mine had a patient worked on a boat. He was gone a few months, so he showed him how to do this. And he did it while he was gone. He came back, the boat came back in a couple of months, and he had the tooth completely rotated. So let's get on with this a little bit. This is further on now. This goes around now. If you've got a cuspid, there is no cusp back here, so you have to pile up some acrylic to keep the rotation power chain underneath that to make the tooth rotate. We're going to show you how to do that in a little bit. Okay, here we go. Now when you get your chain around you, you've got a dental floss on it. You can pull it, run the floss under the arch wire, and pull this around and get it over the bracket right in here. And now you can actually pop it out where this would be on the outside, but this will hold the stress on this, keeps the tooth right up against the arch wire. But you can push this or pull the arch wire away from it if you wish to. Now there it's rotated. Now we've rotated it all the way, and we'll clip it. Now if you're doing quite a bit of rotation on something, kind of overdo it. You see, this is a little more than this side. These little fibers in here on the tooth surface, on the root surface, will pull back on this rotation, and you'll lose a little bit of it. If you've got the teeth jammed together, it'll stay pretty much. When you pull it around, it won't move much in that situation. But here we go. It's lined up good, and we'll get it in. And when you get it in this slot, it's going to tilt this tooth back. It looks like it's going down at an angle there. All right. Now here the case is, after we rotated and after we opened the bite, you see the thing, the whole thing, we had an intruding arch over there, and opened the bite and rotated the teeth. And here I think is the tooth that we rotated, and it's right up against the molar over there. So this is done pretty good. And there the thing is looking straight down at the top of it, you see. You hook it up here first, and you put it around, and you come in here and you take your dental floss on it. You run the dental floss under the arch wire, pull it up, and you can push the wire out of the bracket slot and slide this over the bracket slot. And now you come back and the pressure pulls the wire into the bracket slot, and this keeps the pressure on it. And you need about 4 little deals on these things. About something, I'll try to do 4 of them, and they're joined together in here, and that stretches enough to hook one of them here, 2, 3, and this is the 4th one right there. This is power chain. Okay, there the chain is pulling the tooth up against the wire itself, and you can ligature that tooth in position and take this off at that time. So there we are with that. Excuse me. There's another type of rotation now that we have, and that's where the tooth, you're looking at it from the side. Like here's a tooth that's sitting down in here, and its roots are going out down in here somewhere. And you're going to rotate it, you're going to stand it up, and then pull it up against this tooth. So we're doing a rotation from the side of the tooth. And this is the far best way that I've ever found in correcting this, and we call it uprighting the teeth. And you can do this any time on a person, anywhere. You just bond a wire on about 3 or 4 teeth, and you make this little wire right here. You come out and you circle, you make 2 circles, go to. It comes down like this, and then you put a hook on it, and you put that in there. And then after I got it in there, I wanted more activation, so I stuck one of these double optical pliers. The round part goes here, and the cupped in part up here, and you mash it, and this wire will be going here, and you can make it go down like that, and then that adds to the activation, and it makes this tooth come up a little faster. Now there's no need to come in up here and grind this tooth off. Leave it alone, let it bump this tooth above it, and it'll keep it down, and this tooth will end up just sitting right in this position right there. And then if you want to drag it up to close it, you can keep this force on it and pull it forward right there. And that is the absolute best way. This is my feelings on this now, and I've had so many teeth done like that. It is the far best way to do it. Now, you could take somebody and just walk off the street and come in and say, I want to straighten this tooth up right here, or correct the rotation in that. And you can stick this wire on the guy's teeth. You come in and you put a bracket over this. If you can't get to the side of the tooth, you take electrosurge or whatever you want to take the tissue off the side, and you put the bracket on here. Now we do all these with rectangular wire. And you start putting a lot of pressure on that with a round wire, it'll flip and go one way or the other, but the rectangular wire will just bring that tooth right straight up out of there. And that is the best way I've ever found to rotate teeth, and it pushes down on these teeth out here, and that gives you plenty of force to raise this tooth up, and it'll usually come up and have a gap in it. And you keep the pressure and then tie this on to one of these and pull it up and continue to keep pressure on it, and you have come in and you can put the roots of it right up there next to the other tooth. So let's get on down the road here, and this is the wire we had. Now you put this hook in this wire. If I take this out, I had to bend this after I had it up there, because the wire would be headed down and digging in the tissue of this person. And you have to figure out where you're going to mark, and you put the hook right behind one of your bonded spots, because as that tooth goes up, this wire is going to slide back in this area. So you have to fix it where it can slide back. You just bond a wire on several teeth, and you can correct a wisdom tooth 10 years after you get through with the rest of the orthodontics, if you need to do that. Now we're going, this is the bicuspid we were working on. This is the chain, and I'm going to get over here and thing that shows you where we take a piece of elastic chain and run a dental floss this piece of dental floss through it like that, and then you get 4 of the eyelets, and that's enough. You hook this over the arch wire. Now we've got it. Here the thing is out here, and we got the arch wire. The dental floss holding it here. You take that, and now we're going to put the attachment of this right next to the rotated side of the tooth. So it'll go around like this and come over here, and you hook it on this. It will pull the tooth to the arch wire and slide the bracket slot will just come in there, and you bring it around and hook it onto that without the end of it. You don't want this end of it attached to that arch wire at all. So there we are. You brought it around, and now here we've got a piece of that power floss, and we stick an elastic chain. You put the dental floss through one end and double it, you see. And now you take those 2 ends and push them through over here. But before you do that, you run this under the arch wire. So if you're going to wrap it around this particular tooth here, you're going to have to keep it right in this area, you see. Now pull on this. It'll pull this out, and it'll pull this part through this hole, and it'll have it wrapped right around that arch wire there. All right, here we're tugging on a little bit, and we tug a little more, and it looks like that. Now a little more. Now we tug on it all you want to, and the tooth is in there. Now if you got a tooth that's got a crown on it, kind of like this, and you can run this wire down here. But if it's a cuspid and it's coming up like this, you've got to put some composite right like that, and that'll have your wire down under the composite so it won't slide over the top of the tooth when you pull it out. All right, here we're going to pull this up, and we bring the arch wire around. Now we're over the bracket right now, and you can see that it's stretched out quite a bit already. Now I'm going to try to take this dental floss and maneuver this O-ring part right over this bracket right here, and then this elastic chain is pulling this tooth to the arch wire all the time, and you tend to push it down in the bracket slot there. Now there, you're maneuvering it around, and you can hook the other end of this power chain into the bracket. Now that's an excellent way. Now here's a tooth that's got a slope in it, so we put some composite on there. So we'll attach the deal here and come around, and have to get it under that and come back and hook it on this, and that rotates. That tooth will rotate that much just real easy. And we're going to cut 4 of those. All right, we've cut that off, and we run that dental floss under the arch wire, pull the other end through pull the floss through the other end of the elastic chain, pull it down tight, and here's a little girl we're working on. and you pull it and get it snug. And now we're going to run this. This is stretched out here, but we're going to stretch it around this tooth and then hook it on this, but not have it tied to the arch wire on this side, just around here. And then it'll pull this tooth right up to that spot on the arch wire.